Smallpox was one of the most frightening diseases the world has known. So it came as quite a surprise when the U.S. government revealed yesterday that vials of smallpox had been forgotten for decades and were just discovered in a cardboard box.
From that moment, the CDC, NIH, FBI, FDA, and World Health Organization developed a plan of action. Why would a few vials provoke such a dramatic response? Before its eradication, smallpox accounted for more deaths than all wars combined. This 3,500-year-old disease, also known as variola, killed 1/3 of its victims after they suffered from excruciating pustules over the entire body. From the cultures that worshipped the disease to the world leaders who became its victims, smallpox shaped civilizations. Even those who survived, including Queen Elizabeth I and Abraham Lincoln, bore the permanent scars of this pervasive disease. In the 150 years following Edward Jenner's discovery of the smallpox vaccine, only the United States and parts of Europe had eradicated the disease. However, in 1967, the World Health Organization, under the leadership of Dr. Donald Henderson, embarked on an unprecedented worldwide smallpox eradication program that not only rid the world of this deadly disease, but also left a legacy of disease surveillance and vaccine strategies still used in the field of public health today. In 1966, the World Health Assembly met in Geneva, Switzerland. Since previous attempts to eradicate diseases had failed, the Assembly feared taking on another unsuccessful program that might further damage its reputation.
There were certainly a lot of naysayers, those who didn't think we could do it.
I remember the head of communicable diseases for WHO saying that we would never eradicate smallpox in India. He would bet anything on it. In fact, he would bet a tire. He would eat a tire from a Land Rover if we eradicated smallpox.
Despite objections from the head of the World Health Organization, the Assembly passed the proposal and embarked on a 10-year program to eradicate smallpox. The U.S. Minister of Health selected Dr. Donald Henderson, a young epidemiologist, to lead the smallpox eradication program. Many experienced health officials wished to avoid involvement in another doomed program, especially one headed by such a young leader.
And we recruited preferentially people in their 20s and 30s who really felt as I did, we'll get the job done. And as one director general said, that was the big advantage in the program, that you had a number of people who simply didn't know that this was an impossible task.
He had the ability to rally people from different backgrounds to a vision of smallpox zero.
From Africa to Asia, from cities to remote villages, these young public health officials faced harsh weather, poverty, and civil war to find and eliminate smallpox.
It was a battle. It was a battle. I have used the term, it was a war against disease, and you're a band of brothers and sisters in fighting.
Dr. Henderson witnessed these challenges firsthand rather than leading from afar.
So he always went to the field. That you can't just sit in Geneva or in Washington, D.C. and run a program. You really have to go out and see what the challenges are, and then how can you better impact those challenges in your role as a global director.
To address these challenges globally, Dr. Henderson implemented innovative strategies originating from the field. For example, prior to the beginning of the program in 1967, mass vaccination was the only strategy used in efforts to eliminate smallpox. However, even when officials vaccinated 90% of a population, the disease would continue due to movement from community to community. Dr. Henderson argued in favor of a new surveillance containment strategy. When a case was detected, they isolated the infected individual and performed what was called ring vaccination by vaccinating individuals around the patient. This idea faced opposition, but after early successes in eastern Nigeria and West Africa, surveillance containment was adopted as a new vaccination plan for the program and would change large-scale vaccination techniques forever. In order to implement surveillance containment and track outbreaks of smallpox, the program created a monthly system in which countries would report cases to Henderson and the World Health Organization. This resulted in the program successfully allocating resources to confront the disease. In order to fully address the challenges of disease surveillance and containment, Dr. Henderson needed to confront issues surrounding communication.
One of the biggest problems we had was of communication, because at that time there was no email. There was, the telephone connections were comparatively limited to countries. It was so expensive we really couldn't use it.
Another concern had been that this program, whose greatest contributors were the Soviet Union and the United States, was taking place during the Cold War. Fortunately, the public health officials in both nations put political differences aside in favor of public health.
When the worst days of the Cold War were going on, we would have from the US and Russia sitting down together with me and others and plotting what do we do next and where do we need more money, what do we need to do.
After 10 years of intensive efforts in Africa and Asia, the Smallpox Eradication Program saw the final case of smallpox in Somalia. After 2 years of surveillance and anticipation, the World Health Assembly convened in Geneva in May 1980 and officially declared the smallpox campaign a success. This program left a legacy of a smallpox-free world, having rid the earth of a disease which had plagued humanity for millennia.
And that by doing something like a smallpox eradication program, literally has saved millions of lives, has saved the system billions of dollars that could be put towards something else to prevent other suffering.
In addition to the death of a disease, Dr. Henderson and the Smallpox Eradication Program altered the field of public health through the development of disease surveillance and containment methods.
Before, I think, smallpox surveillance or reporting was thought someone out in a dispensary in the field writes a report, sends it upstream. No one reads it, no one cares, it's filed away, just numbers of cases. No one even knows how it's diagnosed. But now I think people understand the importance of, what gets measured gets done.
The Smallpox Eradication Program left a legacy of a disease communications network in which hospitals and health centers worldwide report cases of suspected disease outbreaks to larger organizations such as the World Health Organization and CDC.
Some of the surveillance stuff that they did, we're still using for some of the contact tracings that they did originally. And so it really is one of the big stepping stones.
As a result, when outbreaks are detected, public health officials may respond quickly and with the appropriate resources, including vaccine. Today, eradication programs such as the one for polio have adopted the same surveillance containment techniques introduced in the Smallpox Eradication Program.
But I certainly appreciated the experience I had with polio eradication and appreciated how much we benefited by the success of the Smallpox Eradication Program.
In the end, as the nightly news reveals another case of measles in the US, or the World Health Organization reports cases of polio abroad, we are left to wonder, did the Smallpox Eradication Program really change anything? While disease still exists, Dr. Henderson and the Smallpox Eradication Program have changed the question from can we to will we. Smallpox is gone from our lives. We have developed innovative surveillance and vaccination techniques that have helped us to make significant gains in conquering other diseases. Most importantly, we have learned that the impossible is achievable, and that when the world is ready to unify once again, we can rid our world of deadly and debilitating diseases.